I'm sure you've heard about the controversy with acetaminophen in pregnancy, but what does the research really show? Well, let's look at it. So, did you know acetaminophen is in over 600 products, prescription and non prescription? And it's estimated more than 60% of women that are pregnant take acetaminophen during their pregnancy for headache, fever, or pain. And about 20% of those actually take it for more than 20 days. I've got my references for all of this information, by the way, and there is a link in the description to the reference page. Now, pregnant women are not able to take ibuprofen or full strength aspirin. They're contraindicated because it can actually change the fetal circulation and cause cardiac issues. However, low dose aspirin has been used successfully for high risk women to help prevent the risk of preeclampsia. I'm sure you've heard by now about the announcement on September 22nd from Robert F. Kennedy, the Health and Human Services Secretary, and President Trump that FDA was going to come out with a statement about acetaminophen in pregnancy. And so there is research out there that there might be an association between acetaminophen and neurodevelopmental problems in the newborn. There's also studies saying that there is no association, and so that's why there's a controversy about it. But Health and Human Services wanted to advise physicians and nurses and midwives that it may be better for patients that are pregnant to use the lowest effective dose for the shortest duration when treatment is required with acetaminophen because of that potential risk. So the FDA notice came out, and they say that the risk can be more pronounced when the acetaminophen is taken throughout pregnancy and all the way up to childbirth. And the neurological conditions that are of concern are autism and ADHD. And so there is an association with those in the studies with acetaminophen. However, we don't have evidence that it actually causes it. And so that's another reason why there's controversy in the research. And so they went on to further state that clinicians should consider minimizing the use of acetaminophen during pregnancy for routine low-grade fevers. So what's a low-grade fever? It's usually defined as less than 100.4. So 99.1 up to 100.4 could be considered low-grade. And then ACOG, the American College of OB/GYN Physicians, came out with a news release. And they say that acetaminophen is one of the few options available to pregnant patients, and that the conditions people use acetaminophen to treat during pregnancy are far more dangerous than any theoretical risk. And so they're saying that acetaminophen is still safe in pregnancy. And they also stated in that a lot of the studies that are looking at that association had confounding factors, or they were unreliable because it depended on self-reported data. In other words, they were going by the pregnant moms trying to remember how much acetaminophen they took. And so they felt like that there really are not any high-quality studies that really show that association. But what does the research actually show? Let's look at it for ourselves. So this is interesting. This is an article that came out in the journal by ACOG called Obstetrics and Gynecology. And this was a perspective. This was published this year. And they also said they looked at 56 studies, commentaries, and editorials, and that they found important biases, a degree of selection bias, variability in selection and adjustment for various potential confounders, and also unmeasured familial confounding. In other words, looking at could it just be something that is genetic. And so they felt like that it's unlikely to confer a clinical important increased risk of childhood ADHD or ASD, that's autism, with exposure to acetaminophen in pregnancy. And so they came out with this statement: the current level of evidence does not warrant changes to clinical guidelines on the treatment of fever or pain in pregnancy. And then also, I do want you to notice there is a financial disclosure. So when authors have any type of a financial disclosure, it has to be listed on the article. So one of the authors you can see was an expert witness in a legal case involving acetaminophen. So usually expert witnesses are paid. And then the other author receives research funding from, you can see this is a lot of the big pharmaceutical companies. So just saying that is there for your interpretation. Now, this is really interesting. Did you know back in 2021, there was a consensus statement put out by 91 International. So from around the world, we had scientists, clinicians, and public health professionals all came together. They summarized the evidence and their concern about acetaminophen use in pregnancy. And this paracetamol is the name of acetaminophen, like over in Europe. Okay, so it's the same medication. And what they found is out of 26 to 29 studies, there was a strong association with acetaminophen in pregnancy and autism and ADHD. And they stated that they felt that from this research that acetaminophen in pregnancy could alter fetal development, which could increase the risk of some neurodevelopmental, reproductive, and neurogenital disorders. So ADHD, autism spectrum disorder, language delays, and then also in males, undescended testicles were found. And so that's why they came out with this precautionary statement. And these are the recommendations you can see there on the slide, that pregnant women should only use acetaminophen when it's medically indicated. They should consult with their physician or pharmacist if they're uncertain whether it's indicated and before using it long term. And they should use it at the lowest effective dose for the shortest possible time. Now, this is a research study by the researchers at Johns Hopkins University, so pretty prestigious medical school, right? And they actually did cord testing. So they took the umbilical cord from the newborns and tested it for acetaminophen and metabolites of acetaminophen. And what they have found is that higher levels of acetaminophen in the cord had an association with a higher risk of ADHD and autism spectrum disorder. In fact, the children in the high exposure group were 3.62 times more likely to be diagnosed with autism and 2.86 times more likely to be diagnosed with ADHD compared to low exposure group. So that was what they concluded. And there again, an association doesn't mean that it causes it, but there is a strong association in this study. Here's another prestigious medical school, Mount Sinai School of Medicine. Those researchers looked at the literature and they found that the higher quality studies were more likely to show a link between prenatal acetaminophen exposure and increased risk of autism and ADHD. They said that acetaminophen, we know, crosses the placenta and that it could affect the baby's brain development with oxidative stress, disrupting hormones, and other changes that can interfere with that fetal brain development. So they also recommend using acetaminophen at the lowest effective dose for the shortest duration under medical guidance. This is a study that was done in Illinois. It was a prospective birth cohort study. And what they did was they checked in with the mom 6 times throughout the pregnancy to ask how much acetaminophen they were taking. So it was a more accurate way instead of asking just at the end of the pregnancy. And then they compared the child behavior checklist scores at 2, 3, and 4 years of age. And what they concluded was that higher prenatal exposure to acetaminophen, especially in that second trimester of pregnancy, was consistently associated with increase, which are poor scores, on that child behavior checklist related to attention across early childhood. And so that is concerning. There again, an association. We can't say that for sure that it causes it, but it does raise enough concern with some of this research, right? So what can we do? We definitely know that, moms need to have a way to treat fever and pain. So let's look at that a little bit further. So fever in pregnancy is defined as greater than 100.4 degrees Fahrenheit, and that's taken by mouth, right? In some studies, they looked at a fever over 102 degrees. And what's concerning is that fever definitely can cause problems in pregnancy. It has been linked to decreased oxygen in the fetus, and it also has been linked to birth defects. So there's a risk of neural tube defects. So that means like spina bifida. Also congenital heart defects and cleft lip and cleft palate. It's also been linked to preterm labor. So we definitely know that there's risk of fever in pregnancy. And so when it gets to that level, we do need to treat it. Now, if it's the low-grade fever, so less than 100.4, we can try some just self-help measures at home, right? So drinking a lot of cool liquids, taking a lukewarm bath or shower, cool washcloths to the face or the back of your neck, Keep a close eye on your temperature, and you might want to think about contacting your provider to see what's causing that fever and do you need treatment for it. Once it gets to 100.4 or higher, then if those self-help measures aren't working, the fever's getting higher, that's when acetaminophen definitely would be the benefits outweighing the risk. And there again, the recommendation is that we can use the lowest dose at the shortest time period as needed. And of course, consulting with your provider. In fact, you definitely need to contact your provider to determine what is the cause of this fever, what illness do you have going on, what treatment might you need, because in pregnancy, some infections can be a lot more serious. So for example, if mom gets a fever in pregnancy and it's from a kidney infection, did you know that she's going to need IV antibiotics more than likely, and there's a risk that she can even go into maternal sepsis and preterm labor. And so we do need to have that pregnant mom check with her provider to find out what is the source of the fever and what other treatment that she may need. What about pain in pregnancy? So headaches are pretty common in pregnancy. There again, what are some self-help measures we can try first? Well, we can try preventing them by eating frequently, drinking enough fluids, trying to get enough rest and sleep. If mom does get a headache, she can try a warm bath, massage, doing some relaxation techniques, a hot pack across her shoulders or back of neck, or then a cool cloth on her face. Another self-help measure would be to use some essential oils. And notice our disclaimer here. To use essential oils in pregnancy, always consult with your provider to make sure they feel like that's safe for you to use. And never take essential oils by mouth. Never take them internally. But peppermint oil has been deemed safe by a lot of resources to use as a type of massage oil. And so if mom has a headache, you can take peppermint essential oil. It needs to be diluted at 1%. So that, for example, would be like 3 drops of peppermint oil and 1 tablespoon of a carrier oil, like olive oil, coconut oil, or grapeseed oil. And use that to massage her head, back of neck, or shoulders. Another idea that you can use is to use lavender. There again, that's an essential oil that has been deemed to be safe by a lot of the resources out there. There again, we're going to use it only externally, right? But you can make a cold compress. You can actually take 2 to 4 drops of essential oil, the lavender oil, mix it with a teaspoon of glycerin and a cup of water, and then place a washcloth in there to soak, and then freeze it. And then you can use that as a cold compress for headaches as well. Now, if the headache's not responding to the self-help measures, there again, if we're going to use acetaminophen, let's try to use it at the lowest dose and the shortest time possible in accordance with your provider's instructions. And you also need to call your provider. If your headache's not relieved with acetaminophen, you definitely need to touch base with your provider, because did you know headache can be a sign of preeclampsia, which is a serious complication in pregnancy. Other symptoms can be visual changes like spots before your eyes or blurred vision, right up abdominal pain, and then swelling that's not improved by rest, which every pregnant woman has swelling. But if you put your feet up and rest and it doesn't get better, or you have facial swelling, that could be a sign of preeclampsia. And there again, headaches not relieved by Tylenol can be a sign, or acetaminophen. That can be a sign of preeclampsia. So definitely you need to check with your provider at that point. What about muscle pain and back pain? There again, what are some self-help measures we can try first? You can try a warm bath or shower, a hot pack or an ice pack, different types of massage, back rub. You can try pelvic tilt exercises for low back pain. As you can see in this photograph, she's in that all fours or hands and knees position. And in that position, if you push up your lower back like a mad cat, that's a pelvic tilt exercise, and then relax back down. You can also do that like up against a wall, for example, and that can help with low back pain. You can consider going to a chiropractor if you're comfortable with that, or asking for a referral for that. And then also maternity support belts can help with that low back discomfort. then there again, we can try essential oils externally. Like we said, always check with your provider first and don't take them internally. But we can actually do a massage with either German chamomile or lavender essential oil. There again, those should be safe for external use in pregnancy according to the resources that are out there. But they need to be diluted there again at 1%. So that would be like 5 to 6 drops of the essential oil in 1 ounce, which is like 30 mLs of olive oil, coconut oil, grapeseed oil, some other carrier oil, and use those for massage. Now, if you're still having muscle pain and back pain not responding to those self-help measures, there again, let's try to use acetaminophen at the lowest dose and for the shortest time as needed according to what your provider suggests. And then there again, you may want to contact your provider to try to find the source of the muscle or back pain. And another kind of little warning is that sometimes preterm labor can present as like some back pain. And so if you are, less than 37 weeks, just make sure you're not having contractions. If you think you're having contractions or feeling pressure or low back pain along with that, definitely check with your provider to rule out preterm labor as well. There again, the resources and references are going to be linked into the description. And if you're interested in becoming certified as a doula or childbirth educator, then check out our website, childbirtheducationforthechristianfamily.com. And we also have childbirth education classes. Thank you.